What are the most common acute injuries? So first we have sprain. Sprains are overstretched ligaments. The ligaments stabilize and limit joint mobility. When the joint is forced into a position that is beyond its normal range, it will overstretch the ligament. The most common sprains are located at the lower limbs, such as the ankle and knee, because they are subjected to stress daily. Moreover, sports participation increases the likelihood of twisting the knee and ankle. An individual usually feels a popping sound when a knee ligament is completely turned. A completely turned ligament may need surgical reconstruction before the athlete is allowed to play again. A sprained joint will take several days or months to heal, depending on the severity. A commonly sprained ligament is the anterior cruciate ligament, or we call it ACL. So the ACL is a connective tissue that helps stabilize the knee every time the muscles contract. The sprained ligament can have minimal tears or it can be completely ruptured. Second one is strain. Strain is a twist, pull, or tear of a muscle or tendon. It is also an acute, non-contact injury that results from an overstretch or overcontraction. Sometimes a muscle would contract and generate a force that is significantly higher than what it usually does. The forceful contraction rapidly pulls the muscle tendon unit, which can result to a muscle strain. The third one is fracture. The most common fractures are located at the upper limbs, such as the hand and forearm. Fractures are common in growing bones because it is less dense. There are also a higher number of fractures in the upper extremities because it is not as strong as compact as the bones in the lower extremities. So usually kaning fracture kay kanang madisgrasya mo sa bike or sa motor or sa cheer dance, kanang mga cheerleader or kanang mga musayaw, asa-asahon sila and then matagak. So usually ang ilahaan ng injuries is fracture. And then dislocation, it is commonly in joints that allow greater range of motion. The most common dislocation are located at the upper limbs, such as the shoulder and elbow. These joints are commonly affected when an individual uses his or her hand to support his or her weight when he or she falls. When the bone is pushed out of the proper alignment, the injury will cause a deformity and constant pain. Furthermore, the individual will not be able to move the affected limb and the pain will be relieved once the bone is repositioned. So kanang ma-dislocate siya like kanang dili siya matarong sa iyahang position. So mao na siya ang dislocation. Bali sa joints lang siya na dislocate siya. So mao na siyang reason usahay nga sakit ang imuhang kanang sa may kamot or sa tiil. And usually pud kana pud na siya mausad na siyang mga injuries nga makuha sa mga dancers pud. Next is concussion. So it is a life-threatening injuries because they disrupt the normal function of the brain. A severe blow to the head could cause the blood vessels in the brain to rupture. As the blood leaks out of the ruptured blood vessels, it will accumulate inside the skull. As the volume of blood increases, the pressure inside the skull starts to build up. The accumulated blood will put pressure on the brain, blocking the blood supply to different areas of the brain. If the condition is not resolved immediately, the brain starts to die, and it is important for the individual to go to the medical facility as soon as possible so that the injury will not worsen.